Hi friends, in this video I am going to discuss how we can tackle reading part A in OET in an efficient manner to score full marks. So first of all, let's look in detail. Reading part A is also called expeditious reading part. In this part, they assess your ability to locate specific information from 4 short texts in a quick and efficient manner. The 4 short texts relate to a single head topic and you must answer 20 questions in the allocated time period, which is 15 minutes. After these 15 minutes, the invigilator will get the question and answer paper from you. So you won't get any time to write it later. So let's see what are the types of questions comes under this section. They are matching, sentence completion and short answer questions. So what we have to look. So if there is any bullet points or subheadings by a definition, like any keywords comes, just note it and just encircle or underline it. So always focus on that one. It will give a clue for you. So just look an example here. So always try to read the instruction given at the top. Then read the heading. Then text A. The subheading is changes in gastrointestinal function. So let's read. And just the technique used here is skimming and scanning. And just look for the general idea. And if any keywords, just underline it. And next go to the second text B and see the subheading is aging factor. And once you get the general idea from this one, you can write at this side. For example, like diagnosis, indications, contraindications, treatment, drugs, like that you can write. So it will be easy for you to scan later. Then text C, hepatic blood flow. So we got an awareness related to the blood circulation there. Then text D is related to the drugs. So in my opinion, it's better to do questions 8 to 20 first, and once you're done this one, it will be easy for you to write the 1 to 7 answers, because in 1 to 7 section they are asking for each questions 1 to 7 decide which text A, B, C or D the information is coming from. So once you done this 8 to 20, you know is from where which text is comes. So it will be easy for you and no need to waste any time there. And another information is that if you stuck on one question and you didn't get the answer, just leave it and go forward and finish the other answers first. And you can come back and done it before you submit the papers. That means within 15 minutes. So at last, if you didn't get it, just try a guess, because if you will not be penalized if you make any mistake. So don't leave it blank. So let's see first 8 to 20 questions. So here it's asking answer each of the questions 8 to 14 with a word or short phrase from one of the text. Each answer may include words, numbers or both. So always try to read the instruction clearly. So let's look the question first. What causes delay in gastric emptying? So now we got an idea. The gastric absorption is discussed in text A. So let's look in text A. The process of aging brings about changes in gastrointestinal functions such as increase in gastric pH, deferment in process of expulsion of gastric juice. So they are asking gastric emptying. Here the expulsion of gastric. So deferment is the synonym of delay. So we should know the synonym. That is, so we have to increase our reading practice and try to learn more synonyms and vocabulary. So it will be easy for you to get full mark in this section. So then next is what can reduce effectiveness of blood thinners. So we have to look for this keyword blood thinners and then effectiveness. So let's look. So we read that the intake of substances that are actively transported from the intestinal lumen, including some sugars, minerals and vitamins, may therefore be decreased in elderly patients apart from the pathological surgery. Just go through there, and this may cause cholesterol binds and decrease the effectiveness of many drugs. So including thiazides, anticoagulant, thyroxine and aspirin. See, aspirin is the blood thinner. So what is the answer? Cholesterol. So in this way you can do this answer. Then let's look another one. Number 12. What is often stamped out by hepatic metabolism? So the keyword is hepatic metabolism and stamp out. So you should know the synonym again. So hepatic is in text C. So let's read. Hepatic blood flow and liver mass change proportion. And you can also highlight the percentages like that. So it will be easy for you. So many benzodiazepines are metabolized by microsomal enzyme to active metabolites, which are also eliminated by hepatic metabolism. So eliminated is the synonym of stamp out. So that is the answer, benzodiazepines. So let's look one more. So last one, 20. Dash is known to be very effective in curtailing down the absorption of drug. So what do you mean by curtailing? Curtailing is decreasing. So which medication is very effective to curtailing down the absorption? So again absorption. So it's very CAT-A. So just see cholesterol and penicillin, while antacids decrease the efficiency of the process of taking in of drugs such as chlorpromazine, tetracycline, isoniazid. So what decrease the efficiency of process of taking drugs? That is antacids. So I think you got an idea how to do it. Then let's go back to question number 1. So in this section, for each question 1 to 7, decide which text A, B, C or D the information comes from. So you may use any letter more than once. We can use any letter A, B more than once, but you should write only A, B like that. So in which text can you find information about? Let's look. So number 1 is substance which is known to decrease absorption. So as you know, we saw the absorption all comes under text A. So the answer is text A. No need to write text, just write A. So second, various factors are known to create an effect on how drug distribution is weakened. So the distribution comes through the blood flow. So the answer is hepatic blood, text C. So see, now it's easy for you. So one more I will do for you. The 3 belongs to the class of medicines called digitalis glycosides. So the medicines comes under text D. So let's look where it is mentioned. Renal blood flow, glomerular filtration, nothing is mentioned about any digitalis diabetes. So let's look. Nephropathy, arthritis. Now drugs. The drugs will the significant toxicity that have diminished renal excretion with age include allopurinol, aminoglycosides, amantadine, lithium digoxin. See, it is the digitalis. So that is text D. So I think it's easy for you to tackle this one, and I can assure you that if you practice, you can do within 10 minutes this batch, so you can get 20 out of 20. So it will be easy for you to get grade B in first attempt itself. So just practice it and try to finish within the time frame. So practice makes perfect. So all the best for your endeavor. Thank you. Bye.